Hello, hashtag listen family. It's Callie Hendricks here, back with another episode of The Theatre. Today I have Neil Cupido with me. Neil, a very big welcome to hashtag listen.
Thank you very much, and thank you very much for having me as well. I really feel it's an honor and a privilege to be here, so really thank you very much.
No, you're welcome, and we're excited to have you. Could you start by telling us a bit, share a bit about your journey? What inspired you to go into healthcare, and how did you transition into managing your own practice?
Just to start off, I grew up, I'm actually from Cape Town originally.
Yes.
And I grew up very poor. And I realized very soon that I'm actually, the only thing that's going to get me out of poverty is to study.
Sure.
And that is how I went into the medical industry. I was actually thinking of maybe law, but I can't lie so much. Because I was good at numbers, but
Sure.
if I did it too much, then I would basically dream about it.
Sure.
So I realized, okay, no, I need to do something that can differ. You understand, that I can have a variety of what I do in the same field.
Sure.
So that's basically, in a nutshell,
How you started,
how I
yes.
started.
And how did the business side of it come about?
I was kind of forced to come to Kimberley. I didn't, Kimberley just has a big hole for us that stays there in Cape Town. So I was forced to come for community service to Kimberley in the year 2005. But then I saw, Kimberley is not just the city of diamonds, it's the city of golden opportunities as well.
Sure.
And I realized very quickly that my growth would be much more exponential than in Cape Town, because Cape Town, for us as medical professionals, are quite saturated.
Sure.
Yeah.
Sure. How has your experience been both as a medical professional and as a business owner? And what has shaped your approach to patient care? How has that shaped your approach?
My approach to patient care was basically the same. How I worked in government was the same how I work in private.
Sure.
My approach was basically to treat everybody, like family.
Sure.
And that was my approach.
Yeah.
To give my people and my patients the best care possible than what I could. And that was, for me, that was an easy transition, because I wouldn't treat people different in private than in public. So the transition for me was quite easy.
Okay.
To put it.
Sure. And I can imagine that having, managing a healthcare practice, it involves having that balance of patient care and also the business side to it. How do you balance the two?
You see, my secret was that if you put patient care first, the money would follow.
Sure.
And for me, I've always seen that if you deliver a very good service, because in Kimberley, the service, anywhere you go, the service ain't that good.
Yeah.
But I've realized that's really a gap in the market.
Sure.
So that if you put if you give good service delivery, automatically, doors will open for you.
Sure. And what has been some of the challenges that you've encountered, especially in trying to deliver exceptional patient care and then managing the demands of running a business?
The challenges always comes in if you have a patient that you want to do more, but the funds, especially the financial part, and you have to rely on, other healthcare professionals or government settings, for extra help.
Yeah.
They do get the help eventually, but it takes very long.
Sure.
We would want to try and help our patients as quick as possible, as fast as possible. So that for me is sometimes a bit frustrating, to be honest.
How do you ensure that your patients get that care that they need, or that it remains your priority and your main focus, even when you get busy with maybe administrative or business tasks?
Patient care is always for me the center. I would let the business task and the administrative task fall into the patient care, so that the patient care can be the center of what I try and achieve to do.
Yeah. And like you mentioned that, we are in Kimberley and services sometimes are a bit slow or tricky to get. Providing consistent high quality care is an essential part of the healthcare industry. So what strategies do you use to maintain these standards across your practice?
What I really try and do is I try and liaise with guys that's more advanced than me. guys that's got more knowledge than me. I see where the trend is going to, and like to liaise with the guys outside of Kimberley so that I can see what trends they follow locally and abroad. And that is how I try and keep the standard, to a more international standard.
Yeah. And obviously, when it comes to managing a business, like any other business, you need a team around you. How do you what are the specific things that you've put in place to make sure that your team is aligned with the vision that you have?
I'm basically involved in private practice, in my own private practice, and then I'm involved with the LendMed group as well. So at the practice, I've got a practice manager that really manages a lot of things for me, because sometimes if you grow, you need to delegate.
Yes.
And then at LendMed, we've also got a lot of supportive structures to also, liaise with us and to see how we can better the service for our people.
Yeah. And how do you handle feedback from your patients, and what role does that play in you improving your services?
Kelly, to be honest, I love feedback, but I love criticism more. You understand? If somebody smiles with me, I'm worried. But if they tell me the truth, if they say, look here, I've had a bad experience, that for me is always a challenge, because then I know I can do better. And that for me is always where me and my team, how we can strive to get better, through feedback, even more negative, because I grow better with negative feedback than positive feedback. I'll take the positive with a pinch of salt, but I'll work more on the negative. Because then I know where we're going.
And do you find that helps you a lot more when it comes to your personal development?
Yes, it does. It does.
Sure. Building a cohesive and aligned team is crucial in a medical practice. How do you foster teamwork and create a positive work environment?
At the practice and at the hospital, we're at least quarterly, we've got gatherings, you understand, on a social level where we can just chat, see what's the challenges, see what's the way forward, see our goals. And that is how we, try and just balance out everything.
And obviously having a team that also knows in their respective fields what they need to do is obviously, I can imagine, important as well.
No, definitely.
What leadership principles guide you in managing your team, and how do you motivate them to maintain a high standard?
The motivation really comes from, if we have our team building sessions, so that everybody knows what role they play and where do they fit in. And it's not just about the team that grows, it's also about individual growth. So my motivation to them is more individual growth. If they grow individually, then the team also grows.
Sure. And how do you handle conflict or differences of opinions within your team, especially when it comes to patient care?
Kelly, they all are grown-ups, so I make them sit down.
Yes.
But, I make them sit down. We have an honest conversation.
Sure.
If you're right, you're right. If you're wrong, you're wrong. But we try and never let it hinder, patient care. Patients mustn't even know that there is problems within the team.
Yeah.
And that's really how I would want to approach it and, address it as well.
Yes. And the healthcare industry, it's constantly evolving. How do you stay informed of new trends, technologies, or techniques? And how do you decide which ones to adopt and which ones to leave?
Yes, the healthcare is transforming. It's becoming very digital now as well. So we go to symposiums a lot. We liaise with other places also to see their trends. And then obviously you must come back home and see what will work for me, what will work for where I'm situated, and what would work for my patients and my people.
Yeah.
And that is how we try and adopt it.
And what role does your community, your patient play in that, and making those types of decisions?
Knowing my patients and knowing the community, my background, and where the practice is situated, I would know exactly, this is the challenges. They can't afford certain things because it's no use, you write up expensive medication, but they can't afford it.
Sure.
And then you don't understand why they don't get better. So it's very important to know your people and to know where they're coming from and to know how that they also have challenges.
Yeah. Are there any examples of changes or improvements that have made a significant impact in your practice when it comes to innovation?
What we've done is we're trying to regularly, update systems, and then every 5 years we try and, have a facelift. The problem just is whenever there's a facelift, they think I'm going to go away. So we're a bit worried about that. We had some security issues which we've also addressed.
Yeah.
So that is always how we try and keep, safety and, health.
Yes. And what advice would you give to other healthcare professionals looking to sustain and grow their practices, especially in regions with limited resources?
I would definitely, encourage other guys to say, if you give good service, if your service delivery is of good value,
yes.
That was my secret, and that is how I could sustain my business.
Sure. So service delivery, front and center. Yes. So obviously, Neil, reason why we have you here as a leader, as a professional, is to inspire our listeners as well. And maybe we have a lot of listeners who are part of small and medium enterprises. So what advice would you give to those balancing dual responsibilities of service delivery and business management?
My advice would definitely be service delivery.
Yeah.
Yes, service delivery. If you have something that you sell, or if you have a service that you deliver, do it to the best of your ability. And, with advertising, it grows. With word of mouth, it grows. And that for me was really the center of how I surrounded my business.
Yeah. And how do you market? Like what tools did you use to market when you first started out your business? What tools did you use to get the word out there?
When I started, I used our local newspaper. That time it wasn't so digital. I mean, I'm going to give my age away, but I've been in private practice for 16 years now. So I used the local newspaper. And what I also did was I used to do the clinics around the practice. I used to do it for free, just so people know who Neil Cupido is, you understand? And that is how I would market myself, give good service, and then word of mouth.
Yeah.
That was my basically.
I would imagine over the 16 years you've had to adapt to the times, to the changing times. So how have you adapted in terms of marketing strategies?
I actually stopped marketing. Okay. The practice got too busy.
Sure.
To be honest, you understand. Yeah. I had to stop with marketing because you can only accommodate so many patients. You understand. Yeah. So what we used to do is, or what we're currently doing is, the new doctors that we train and that we embrace, we market them more. To get their name out. You understand. Okay. Yeah. Like individual growth, it expands to the team.
Okay, sure. And then obviously once I'm assuming that they would then go to maybe a different hospital, or how does that work?
Yeah, they would either, stay in the same group and then have their own practices as well.
Sure.
So that is how we maintain, the flow of the profession.
Okay, sure. That's interesting. Are there any key resources, mentors, or experiences that have been instrumental in making your success in making both patient care and the business side?
Yes, Kelly. There's a couple of mentors that I do that that really paved the way for me. It's somebody like Dr. Bavasa. Some of these guys don't even know that they've mentored me. But it's guys like Dr. Bavasa, Dr. Spannenberg, Jenny Spannenberg. It's guys like Dr. Eben van Rensburg, Dr. Werner Visser. He's also a good guy, Dr. Kobus Fourie.
He was my doctor when I'm growing up.
Yeah. So all of those guys, they really paved the way for me. Sometimes without even them knowing.
Yes.
But they really, they in health, but they in the business side of things as well.
Yes.
And with Dr. Van Wyk as well, they teach you medicine, but they teach you more business. That's something that they don't teach you at university.
Yes, yes. And what do you think is essential for long-term growth and sustainability in the healthcare industry?
I think with growth, personally and your team, I think you need to go to a lot of symposiums. I think you need to keep up with the times. And I also think that, again, service delivery is key.
Yeah. What changes would you like to see, especially when we look at Kimberley, or even the Northern Cape? Because I know a lot of our small towns, people come in maybe for public hospitals, they come to Kimberley. What changes would you like to see in how the ecosystem works when it comes to healthcare?
We need, I would love all the people to have access to good healthcare.
Sure.
And I think the way to go about that is basically to have a public-private relationship where we as private guys can help public and public vice versa.
Yes.
Just to get the service delivery, better and faster to all our patients out there.
Yeah. So Neil, what advice would you give to young doctors that are just entering, maybe they're here doing their ComServe, or they've just started in their private practices? What advice would you give them?
I would definitely tell them to have a sense of what the private side also sees, because then you can see that where we're heading to, what we can do, and how we can treat our patients better.
Yeah.
Also to link up with guys that has experience, to show them the way, to paw them the way. There's a lot of things, when you just qualify, that you don't know.
Yeah.
But there is guys that's willing to take you by the hand and to take you on the journey.
Yeah, and you did mention a little bit about your journey in deciding to study medicine. So what advice would you give to, our younger listeners who are maybe still in high school, who are dreaming about becoming doctors? What advice can you give them in which paths to take?
I would definitely tell them that you must decide very early if you want to do medicine. You must make the right choices when it comes to subjects.
Yes.
And then medicine is not difficult, but it's a lot of work. So you need to persevere. You need to be very hardworking.
Yeah.
That is what I would give our youngsters.
Yeah. And you when it comes to working hours, how do you balance, working hours with your personal life?
I'm still young, so so I can work a little bit more.
Yeah.
But I love what I do. So it's really not, these times that I do get tired, that I do feel fatigued, then I'll take a break. But most of the time you are on call, you do work hard.
Yeah.
But there's times that I can feel I'm tired. I just need a break. You understand?
And what practices or what routines do you try and implement, especially when it comes to working irregular hours?
I try and take a break at least once a month. Try and spend enough time with my kids. That's also very important for me. And that's when I'm not a doctor.
Yeah.
Then I'm a father.
Then you're a father. Yeah. So making sure that you differentiate, you can obviously cut off. But Neil, any last words for our audience?
Again, thank you very much for the opportunity. And for the folks out there that wants to pursue a career in medicine, don't give up on your dream. Work hard and persevere.
Yeah. Where can our listeners find out more about your practice?
Okay, my practice is situated in Homestead, 259 Barkley Road. And then I'm also aligned with Lenmed, the Lenmed Hospital.
Okay. Neil, thank you very much for joining us today. That is it for this episode of #Listen the Theatre. We will see you next time.